It's been less than a week since the residents of Migori County took to the streets protesting the poor services delivered by the local government health centers. The residents particularly took issue with the question of the perennial lack of adequate medicine in the institutions. Police investigations in the wake of that demonstration have led to an arrest and the recovery of an assortment of medicines and clinical supplies.
The suspect was a clinical officer, and he was operating this business from his house in Malindi district, that is within Migori district.
Although the drugs recovered were not many, the issue has raised concerns that touch on the integrity of officers charged with ensuring that the public are treated and can access medicine.
And it's unfortunately when the person who is supposed to protect the public against that vice is the one who is in charge, who is involved in taking the drugs for his own personal use. Yes, but in this case, what we have found is some of the quantity involved was small. It's not a huge quantity. It was one thing of each. Some of them were used, so still we are investigating how was he keeping this drug at his residence. Yes.
Indeed, the issue of theft from government medical stores is not a new one. A recent report indicated that the practice has adversely affected the fight against malaria in various parts of the country. The theft of drugs also leaves patients exposed to the purchase of substandard or expired goods. The suspect in this case pleaded not guilty to the charge of possession of government stores and was released on a 20,000 shillings cash bail. He will appear in court on the 4th of July. The onus is now on all those involved along the medicine supply chain to make sure that these crucial drugs reach their intended recipients rather than going to benefit a few individuals. Brenda Wanga, NTV, Nairobi.